Healthy isn't always what it seems. As we age, we often become more health conscious, carefully selecting foods that are supposed to keep our bodies strong and minds sharp. Vegetables, of course, are at the top of that list. But what if some of the vegetables you've trusted for years are not as healthy as you think? What if they are subtly undermining your heart, joints, blood pressure, or digestion? Today, we'll uncover 7 vegetables that many seniors believe are healthy, but could actually be doing more harm than good. And most importantly, we'll show you how to make smarter swaps and eat in a way that supports your unique health needs as you age. If you found this information helpful, please take a moment to give this video a like. It really helps us reach more wonderful seniors like you who care about their health. Potatoes, the blood sugar bomb in disguise. They're comforting, familiar, and on almost every dinner plate, but they might be silently working against your health. Potatoes are a staple in many households. Mashed, baked, fried, or boiled, they seem like a natural part of any balanced meal. But for seniors, particularly those managing diabetes or heart disease, potatoes can be a hidden danger. Why? They're packed with fast-digesting carbohydrates that quickly convert into sugar in your bloodstream. This can cause rapid blood sugar spikes, especially if you're eating potatoes in the form of French fries or buttery mashed potatoes. Over time, these spikes contribute to insulin resistance and weight gain, 2 major risk factors for heart disease. Even more concerning is how common potatoes are. A baked potato may seem harmless, but it has a higher glycemic index, GI, than even table sugar. And when it comes to portion control, it's all too easy to eat too much. Better option: replace white potatoes with sweet potatoes or cauliflower mash. Sweet potatoes have more fiber and vitamins like beta-carotene, which helps with eye health and inflammation. Canned tomatoes, a sodium trap that can strain your heart. Tomatoes are good for you, right? Not always, especially when they come from a can. Tomatoes are a rich source of antioxidants, especially lycopene, which is great for the heart. But many seniors overlook how the form of the tomato matters. Canned tomatoes, and especially tomato sauces and soups, are often loaded with sodium and preservatives. High sodium intake is linked to increased blood pressure, a major concern for seniors already on heart medications or managing hypertension. Canned products also often contain BPA, bisphenol a chemical in the lining of cans that may interfere with hormone balance and increase inflammation. Better option: use fresh or frozen tomatoes instead. If you need the convenience of canned, look for low sodium or BPA-free varieties, and always rinse canned vegetables before cooking. Corn, the sweet starch with little to offer. It might feel like a summer classic, but corn might be doing more harm than you think. Corn is often seen as harmless, even beneficial, especially when eaten off the cob at barbecues or mixed into casseroles. But the truth is, corn is more of a starch than a vegetable, and nutritionally, it doesn't stack up well. It's high in sugar and carbohydrates, with a relatively low fiber and protein content. That means it digests quickly and can lead to blood sugar spikes, much like potatoes. For seniors with metabolic issues or inflammatory conditions, this can be problematic. In addition, much of the corn we consume is genetically modified and may be contaminated with pesticide residues, which can strain your liver and kidneys over time. Better option: swap out corn for non-starchy vegetables like broccoli, green beans, or peas, which offer better fiber, vitamins, and anti-inflammatory benefits. Eggplant, a hidden irritant for sensitive joints. It looks healthy, tastes great grilled, but could be fueling your arthritis pain. Eggplants belong to the nightshade family, a group of vegetables that contains solanine, a natural compound that can trigger inflammation in some individuals. Seniors with arthritis or joint issues might notice increased pain or stiffness after consuming eggplant, but not connect the dots. Additionally, eggplant can absorb a lot of oil during cooking, especially when fried or roasted. That means you're not just getting the vegetable, You're also taking in unnecessary fats that can impact heart health. Better option, if you suspect nightshades cause problems for you, try replacing eggplant with zucchini, yellow squash, or mushrooms. They're low in calories and full of anti-inflammatory nutrients. Celery, the low-calorie veg that offers a little else. To its crisp, it's refreshing, but is it really helping your health? Celery is often seen as a diet food because it's low in calories, but that's exactly the problem. For seniors who need nutrient-dense foods to support their bones, heart, and immune system, celery falls short. It's mostly water and fiber with few essential vitamins and minerals. Eating too much celery may even interfere with certain medications due to its natural diuretic effect, which can lower potassium levels and blood pressure excessively. Better option, choose dark leafy greens like spinach or Swiss chard. These are packed with calcium, magnesium, and vitamin K, all essential for aging bones and hearts. Carrots, the sweet snack that can mislead. They're crunchy, sweet, and great for your eyes, but not if you overdo it. Carrots are known for their beta-carotene, which converts to vitamin A, great for eye health. But carrots are also surprisingly high in natural sugars. When cooked, they have a higher glycemic load than many other vegetables. This can be a problem for seniors managing diabetes or those trying to maintain stable blood sugar levels. Eating too many carrots, especially juiced or cooked in large portions, can undermine your efforts to stay in balance. Better option, stick with raw carrots in moderation and pair them with healthy fats like hummus to slow down sugar absorption. Or try cucumber slices and celery sticks with avocado dip. Radishes, spicy but troublesome for sensitive stomachs. They add a punch to your salad, but might be punching your stomach too. Radishes are praised for being low calorie and having antibacterial properties. But for seniors with digestive issues like ulcers, acid reflux, or irritable bowel syndrome, IBS, radishes can be harsh. They are spicy and can cause gas, bloating, or even stomach pain. Their strong compounds may irritate the stomach lining, especially when eaten raw in large quantities. If you often feel bloated or uncomfortable after meals, this innocent-looking vegetable could be one of the culprits. Better option, go for steamed vegetables like zucchini or carrots in small portions. Cooking breaks down fiber and makes them easier on your digestion. Conclusion, awareness is the first step toward better health. Eating more vegetables is usually a great idea, but it's not just about eating more, it's about eating smarter. For seniors, especially those managing chronic conditions, not all vegetables are created equal. Pay attention to how you feel after meals, talk with your healthcare provider, and consider switching out some of these common healthy foods with better alternatives. Your golden years should be full of vitality, movement, and comfort. And the path to that might just start with what's on your plate. Stay healthy, stay informed, and thank you for watching.